For those who don't know, Aetna CarePass is an API where we view data as the channel where we can actually rely upon the community to innovate. But our constituents, a lot of employers, actually want to see that data flow between all the systems and even pay people money to use these wellness programs. But they won't be able to do it unless the data is flowing and they can see in aggregate that people were using it, that their activity was improving, their weight was reduced, and so forth. So we're very excited about particularly medication adherence, I think, where pharma can bring some of the resources to bear.
I would add, for example, the Scripps has a digital health institute that is actually working with pharma and several pharmaceutical companies to bring innovative technologies, much like the Proteus pill, which my colleague mentioned earlier, to clinical trials, and using mobile devices, whether smartphones or tablets, to those under a clinical trial to be able to really, in a real-time format, know what they're feeling, how they're responding to certain drugs, and so forth. Because again, we view that opportunity as gigantic. Normally a randomized controlled trial, you get a pill and then you have to write it down, or you call into a number and kind of refer what's going on. Now they're getting more into trying to get to the heart of what happens as the person actually takes it. There's also this growing area of pharmacovigilance, which many institutions are really beginning to look into. Again, really with pharma at the heart of that.
A new form of computing called cognitive computing, artificial intelligence. Watson played Jeopardy a couple of years ago, and Henry mentioned this thing called APIs that they've opened up. So we have Watson sitting in a cloud, so just in a server somewhere, and you can come in as a developer and connect to it and build an application on top of that. And if you're at all interested in anyone that's done that, Welltok, W-E-L-L-T-O-K. So it's got analytics, it's got social, because it's direct to the customer, the well patient, right? So the goal is to keep everybody well before they get in to the hospital or into the four walls of a healthcare system. So now, instead of just going to Yelp saying, hey, I would like to find a Greek restaurant in my local area, using this analytical computing, understanding you as a person. You're a vegetarian, you're a vegan, you have congestive heart failure, so you gotta watch your salt, you have diabetes, you have to watch sugar. It will also then, Welltok has created a display, an intuitive display, and a social platform, media platform, that will tell you sort of what to order. Right? So we're really individualizing your health and wellness early on.
From a policy, regulatory, legislative, legal perspective, hopefully we'll have more clarity from the Food and Drug Administration on issues such as accessories and medical devices, clinical decision support software.
I would pay attention to what Apple has already signaled, which is that they've hired away 2 CEOs of major fashion houses, and they've built a sapphire plant to make synthetic sapphires in the middle of Arizona. And my prediction is that there is going to be a new tenor of conversation that you don't just wear these things and use these things because they make you healthy, it's because they delight you.
I get a sense as we move out onto the exchanges, the health exchanges, and we are more responsible for our own care and the cost of our care. My Fitbit data, along with my other data, will determine how much I pay per year. If I'm smoking and I get on the scale every day and I'm overweight, I think there's that data we're going to make meaningful use out of that.